Meningitis is one of the most urgent medical emergencies I encounter in clinical practice, and the reason it remains so dangerous despite modern medicine is not because treatment is inadequate. It is because the window between early symptoms and life-threatening deterioration can be devastatingly narrow. Early symptoms can be mild enough to dismiss. Deterioration can be rapid. Some patients have died within hours of the first signs appearing. I have seen this. Most doctors who work in emergency medicine have. This video is not intended to cause unnecessary alarm. Most headaches, most fevers, most stiff necks have entirely benign causes. But knowing the warning signs of meningitis could genuinely save your life or the life of someone you care about. And that is worth understanding clearly. My name is Dr. Victor Hayes. Let me explain what meningitis is, who is at risk, and critically, what to look for. Meningitis is inflammation of the meninges, three thin protective layers of tissue that wrap around your brain and spinal cord. When we discuss meningitis and encephalitis together, it is because they present very similarly and can be difficult to distinguish in the early stages. Encephalitis is inflammation of the brain tissue itself, rather than just the surrounding layers. Both can cause fever, confusion, seizures, and reduced consciousness. Both can be fatal. In emergency medicine, we frequently treat for both simultaneously because we cannot reliably differentiate them without specific tests. What causes meningitis? The most serious forms are bacterial. Meningococcal disease in particular can be life-threatening within hours. Viral meningitis is far more common and usually less severe, though still requiring proper assessment. Fungal and other causes exist, but are less common. The specific pattern of symptoms depends on age, immune status, and the organism involved. Infants may not show the classic signs and can deteriorate with very different presentations than adults. This is why I am going to go through specific age groups as well as the general warning signs. The classic triad of meningitis symptoms in adults and older children is fever, severe headache, and neck stiffness. But you need to understand that all three are rarely present simultaneously at the outset. Often, the disease begins with symptoms that feel like a severe flu, high fever, feeling profoundly unwell, body aches. The specific meningitis features may emerge hours later. The headache associated with meningitis is distinctive. It is typically described as the worst headache of the person's life, sudden, severe, and different from any headache they have experienced before. It is often described as thunderclap in onset. Any headache described in those terms, sudden, severe, unprecedented, requires urgent medical assessment regardless of other symptoms. Neck stiffness in meningitis means genuine inability to touch chin to chest, not just discomfort. You can test this yourself or on someone else. Ask them to try to bring their chin toward their chest. Resistance or inability to do so, combined with other symptoms, is a significant clinical sign. Sensitivity to light, photophobia, and sensitivity to sound are also common features. The person typically wants to lie in a dark, quiet room. Now, the warning sign that most people know about, the rash. A non-blanching rash, one that does not fade when a glass is pressed against it, indicates bleeding under the skin from damaged blood vessels. This is a sign of septicemia, when the bacteria have entered the bloodstream. It does not appear in all cases, and it typically appears later in the illness. Do not wait for a rash to seek help. The rash indicates the disease has already progressed to a dangerous stage. The glass test: press a clear glass firmly against a rash. If the rash fades and disappears under pressure, it is blanching, generally less immediately concerning. If the rash remains visible through the glass under pressure, it is non-blanching. Seek emergency help immediately without delay. The rash can start as small, pale red spots that look like pinpricks, petechiae. It can develop into larger bruise-like areas, purpura. It can appear anywhere on the body. Check the trunk, the legs, under the arms, and on the palms and soles. In dark skin, the rash may be more visible on the palms, soles, gums, or inside the eyelids. Other signs of serious meningococcal disease include cold hands and feet with a high body temperature, a combination that reflects the circulatory system shutting down peripherally. This is a serious warning sign. Mottled skin, a blotchy blue-gray discoloration, confusion, altered consciousness, unusual drowsiness, an extreme aversion to bright light, a bulging fontanelle in infants. The soft spot on a baby's head normally dips slightly when lying down. If it is bulging, this indicates raised pressure inside the skull. In infants and very young children, the presentation differs significantly from adults. The classic headache and neck stiffness are much less reliable. Instead, look for a high-pitched, unusual cry different from normal crying, refusing feeds or inability to feed, a tense or bulging fontanelle, unusual drowsiness or difficulty waking, dislike of being handled, even gentle touch causes distress, pale, blotchy, or mottled skin. Fever in infants under 3 months is always an emergency, regardless of what else is happening. Always seek immediate medical attention for any fever in that age group. Older adults and people with weakened immune systems may also present differently. Fever may be absent or low grade. Confusion may be the predominant feature. This makes meningitis harder to identify in these populations, but no less dangerous. There are also important things about vaccines that people need to understand correctly. Vaccines have dramatically reduced the incidence of many forms of bacterial meningitis. However, protection is not lifelong for all vaccines. Strains continue to evolve, and not all strains are covered by available vaccines. Having been vaccinated as an infant or teenager does not guarantee complete protection throughout life, and new strains can emerge. This means that even vaccinated individuals can develop meningitis, and vaccination history should never be used to dismiss symptoms that are otherwise concerning. The critical principle in meningitis management: when in doubt, act. The consequences of undertreating meningitis are catastrophic. The consequences of seeking emergency help for something that turns out to be viral or benign are minimal. There is no situation where waiting to see if symptoms improve overnight is the right decision when meningitis is in question. These are the situations requiring immediate emergency assessment. Call emergency services or go directly to an emergency department. Sudden, severe headache unlike anything experienced before. Neck stiffness preventing chin from touching chest. Non-blanching rash of any kind. High fever combined with cold hands and feet. Confusion or altered consciousness. Seizures. An unusual high-pitched cry in an infant. Any combination of the above symptoms. Do not wait for all the classic features to be present simultaneously. The rash is a late sign. By the time the full triad appears, the disease may be significantly advanced. Antibiotic treatment must be started as early as possible if bacterial meningitis is suspected. Every hour of delay in antibiotic treatment worsens outcomes. In genuine suspected bacterial meningitis, empirical antibiotics are given before a confirmed diagnosis. The risk of waiting for confirmation is too high. The message I want to leave you with is not anxiety. The vast majority of headaches, fevers, and stiff necks are not meningitis. But meningitis is serious enough, fast enough, and unpredictable enough that recognizing these specific patterns and acting on them without delay is potentially the difference between complete recovery and devastating harm. Know the signs, trust your instincts. When in doubt, always seek emergency help. Please share this video with people who have children or teenagers or who work in environments where meningitis transmission is more likely. And subscribe to this channel for more evidence-based clinical content. I will see you in the next video.